Hello, this is Dr. Ekin here. My GMC reference number is 7971425. Hello,
Hello,
this is Dr. Ekin, one of the doctors working here. Before we begin, can I have a name and age, please?
Johannes Smith, 55.
And how would you like me to call you?
John.
Mr. John, how can I help you today?
Doctor, I want to have a PSA test done.
Okay, surely I can help you with that. But why do you want a PSA test to be done?
I'm really very worried about my health, doctor. And my friend has recently diagnosed with some cancer after he had PSA test. I just want to have this test, doctor.
Okay, first of all, I do apologize about hearing about your father. And may I know how is he doing at the moment?
I don't know. He's taking treatment. Earlier we used to play golf, but recently my friend has diagnosed with cancer and he doesn't come to play, and I'm really worried about myself also.
I can understand where you're coming from. Don't worry, we can help you with a PSA test. But do you know why a PSA test is done and what's your understanding of PSA test?
No, doctor, I don't have much idea regarding this.
So let me explain it to you before we dive into details. The thing is, PSA test is a screening test, what we say the prostate specific antigen. We actually check this level as an early marker for prostate cancer. But let me tell you that it can become positive in other conditions like benign prostatic hyperplasia. That means a benign swelling of the prostate gland, and in sometimes the urinary tract infection, some sort of infection might also cause the increase in PSA. And may I say, some sort of sexual activity can also increase the PSA level. So an idea is obtained by getting a PSA test, but it's not absolute. Did you understand?
Okay. So should I do the PSA test now?
It's completely up to you, but I want to say some benefits, and there are some uh, benefits and the pros and cons of doing a PSA test.
Okay,
So,
doctors.
okay, but before that, I want to know, do you have any particular concern that I can help you with?
No, that I'm really worried about cancer, doctor. Please give me something. Please do this PSA. I really want to be assured.
I can see that you're worried about cancer, but let me ask you a few questions to check how you're doing in terms of your health. Would that be all right? So,
That's fine.
okay. Do you have any problems in passing urine?
No, doctor.
Do you have any sort of frequency of going to urination? That means increased tendency to go to the loo, pee and loo.
No.
And do you feel like you're straining to pass the urine?
Straining? No, doctor.
And do you feel like you are hesitating to pass the urine?
No.
And is there any dribbling after you complete voiding?
No.
Okay. And do you have any back pain?
No.
Okay. And have you noticed any change in your weight or appetite?
No.
And any fever or any lumps or bumps anywhere?
No.
That's good. And as as a whole, how are you doing in terms of your general health? Do you have any diagnosed medical conditions?
No, doctor. I don't think I have any medical condition.
Are you allergic to any medications?
No, I think not.
Okay, I just want to rephrase a sentence that you just told me. So, anyone in your family with cancer? You just mentioned that your friend had cancer, but anyone in your family with cancer?
No.
That's good. And any other problems that you would like me to address? Any other things?
No, doctor.
Okay. So let us get back to your concern, what you were stating at first. So the PSA test, it's a very early marker. So early marker of a prostate cancer. That means we can diagnose the early stages of a prostate cancer by doing the PSA test. In cases we can find PSA test is the PSA level is high, and like the patient is having any early symptoms, we can definitely make an urgent referral to a urologist. They can do some tissue sampling, send it to the lab. After getting confirmation, then they can offer you with proper treatment. That means you will be completely cured in case then there is cancer. So that is one of the important advantages of doing the PSA test. Did you understand what I just told you?
Oh, okay. So, okay, doctor.
Mm.
But still, I just want to have this test. I am really worried about cancer, doctor.
Okay, I can see that you're worried, but let me reassure you, after talking with you, you don't have any symptoms of cancer. But if you want to go through this test, it's completely up to you. You have every right to do it. All right. But let me tell you some cons of doing the PSA test, because in some in some conditions, like what I just told you, like any enlargement of the prostate or any sort of infection, maybe a person having sexual activity might have this increased PSA test, which might give a false impression of prostate cancer, which is not true.
But enlargement is prostate is also important, isn't it, doctor? If I have.
It's definitely important, but the thing is, there are medications that you can take, and with BPH, people can live a long life and a healthy, beautiful life. That means a normal life. All
Okay,
right.
okay.
So the thing is, are you sexually active? A question that I'm sorry to have asked you later.
Uh, no, doctor, it is not done so much
Okay.
active.
So the thing is, yes, about
So,
the thing.
doctor,
Mhm.
what will you do if my PC is high?
So in case your PSA is high, we have to rule out other conditions of the increased PSA. So suppose the PSA level is high, we will, in case that we will won't take any risk, we will refer you urgently to the urologist by a 2 week suspected pathway. But let me reassure you, not everyone who goes through this pathway ends up having cancer. All right.
Okay.
So I've already told you what urologist will do in the meantime. And also, if it's high, we can also do a special test, what we call the DRE test, which will involve inserting a finger through your back passage and palpating the prostate to check if there's any irregularities or not.
Okay, so you won't do anything today?
So at the moment, I would ask you, after telling the pros and cons, so what, it's completely your decision to do the PSA test. So if you want, we can write a note, request for a PSA test.
Okay, then I think it's fine, doctor. Okay, I want PSA test.
Okay, then we can surely help you out with that.
Thank
Thank you so much.
you.